Ear piercing. Gun versus needle. Which is safer?
Welcome to our in-depth discussion on ear piercing. Today, we are exploring two common methods of piercing, the gun and the needle. We'll compare these methods based on their safety, health risks, and the healing process. It's essential to make an informed decision, so let's dive right in to figure out which method is safer, the gun or the needle.
How does each method work?
In the ear piercing world, there are two primary methods, using a piercing gun and using a needle. 1. Piercing gun. These devices work like a stapler. The earring stud is loaded into the gun, and with a quick, firm press, the stud is inserted through the earlobe. This method is often seen in mall kiosks and some jewelry stores. 2. Needle piercing. In this method, a hollow, sterilized needle is used to create a hole, and the jewelry is inserted through it. This procedure is typically performed by trained piercers in a tattoo or piercing studio.
Which is safer, gun or needle?
When comparing safety between the gun and needle methods, multiple factors come into play such as sterility, trauma to the tissue, and precision of the piercing. 1. Sterility. Piercing guns are made of plastic and cannot be autoclaved, the process used to sterilize surgical instruments. This means they have a higher risk of causing an infection. On the other hand, piercing needles are single-use, made of medical-grade steel, and are sterilized before each use. 2. Tissue trauma. A piercing gun uses a spring-loaded mechanism to force the earring through the tissue, causing more trauma. This can lead to complications like swelling, infection, and keloids. A needle, however, removes a small core of tissue, making room for the earring and resulting in less tissue damage. 3. Precision. A piercing gun can be less accurate due to its mechanism, while a needle allows the professional piercer to control the process and be more precise. In light of these points, the needle method is generally safer than the gun method for ear piercing.
What about the healing process?
When it comes to the healing process, the needle method typically results in quicker and more comfortable healing. The reason is simple. Less trauma caused to the tissue translates to easier healing. It's important to remember that aftercare is crucial with either method to prevent infection and promote healthy healing. In conclusion, while both the gun and needle methods are commonly used for ear piercing, the needle method is considered safer due to better sterility, less tissue trauma, and more precise piercing placement. The decision ultimately lies with you, but it's always best to be informed about the pros and cons. Thanks for watching, and we hope this video has been helpful in your ear piercing journey.